Good evening. The Rio Rancho Board of Education special board meeting for Monday, August 2nd, 2021 is now called to order. If all would arise for the Pledge of Allegiance, Catherine Cullen will recite for us.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, thank you, Board Member Cullen. Give Kim just a second to take our roll call. Okay, we're going to go ahead and do a roll call now. Are you good, Kim, to do that, or would you like me to do it?
I can do it. Okay. President Galbraith.
Present.
Vice President Morgan.
Present.
Secretary Scott.
Present.
Board Member Cullen.
Present.
Board Member Coleman.
Present.
And we have 5-0.
Thank you. We have a quorum present tonight. We'd like to welcome everyone out to our meeting tonight, those who are with us here in the boardroom and those who are in on YouTube. We're grateful to have all of the members of the community and from our district staff on tonight. Tonight we will start off our meeting with some introductory comments by our Superintendent of Schools, Dr. V. Sue Cleveland.
Good evening, everyone, and it's wonderful to have you with us tonight. This is the first day. Our staff is back today, and it's a pretty exciting beginning for us. So I have a few remarks I'd like to share with you, and kind of set the stage for some of the presentations later this evening. So as I said, our staff returned today. We welcome them back. It's exciting to see them back on day one of the new school year for staff. And we certainly welcome all of our new and returning staff. As you heard at the last board meeting, we are in far better shape with regards to staffing than we have been the last several years. We still are short 25 teachers. And so if anyone knows of anyone who might be interested, they certainly can check our website. We would love to have an opportunity to speak with you. If we are not able to locate those 25 teachers, we do have some alternative plans that we could possibly put into place. We also have a lot of brand new staff members this year. We had a lot of retirements last year. And so we have a lot of new faces, and we welcome you to our district. We're delighted to have you, and we're so glad you decided to be part of our school family. Professional development sessions are being held across the district for the schools that were unable to access their buildings as of yet. Their staff are all meeting at off-site locations, so that went very well today. As you know, we will have our convocation on August the 4th at 2 o'clock. The theme is the hero effect, and we have a really great speaker for that afternoon, and I really hope that everyone will tune in to attend this session. The first report that we're going to have is a facility challenges report, and Melanie Archibald, who is our Executive Director of Facilities, will present the information regarding our two schools that are not quite ready to open on the first day of school.
Hey, Dr. Cleveland, can you hear me for a second? I hate to interrupt you. Would you just give us one moment? We're going to have to take a 5-minute recess. I apologize to interrupt your comments. We're going to take a 5-minute recess, and we'll come right back into your report.
Okay, not a problem.
Okay, thank you. Okay. Kim, you want to go ahead and count us down to, I don't know if we actually might still be on our feed, but.
Okay, if you're already going to count you down to resume the meeting in 12, 11, 10, 9, 8, 7.
Okay, this meeting is now called back to order. Dr. Cleveland, are you on? I apologize again for cutting you off, but if you want to go ahead and continue on with your comments, thank you.
Okay, not a problem. As I said, Melody Archibald will present information regarding the 2 schools that are not quite ready to open for the first day of school. And those schools are Colinas, Del Norte Elementary, and Mountain View Middle School. Both of those schools will start on time, but they will start in a remote learning until the facilities can be open to in-person learning. And so the actual opening in person will be August 23rd. To the best of our ability, we think that's a pretty firm date. And so if you have ordered anything, or if you have tried to buy certain things and you find they're not available, we have a real supply chain issue in the country right now. A lot of things that just simply were not available on time. And so that has been a major factor for all construction, whether it's school construction, whether it's personal, residential business. We have certainly had some challenges in terms of getting things here. The other, certainly and it was a shorter summer than we've had in the past. It was a 2-month summer as opposed to 2.5. So there were a lot of things, but the great thing is all last year we learned how to do remote and virtual. And so we'll be getting the Chromebooks out, and all of the children in those schools will be able to go to school on day 1, and we'll get them in the building just as soon as possible. Also, we will have a discussion and decision related to masks. And so we will, I want to kind of give you a little bit of information. We have been waiting all summer for the toolkit, which is the guidelines, the regulations to come from the public ed department. And we finally did get those about a week ago. And that is certainly the latest information that we have. And there have been some additional changes from CDC related to their recommendations, but we have not seen any adjustment as of yet with regards to that. So we're operating under the toolkit that we shared with you a week ago. That's the one that's still in force, and that's the one that we are following. The public health orders generally come out every 2 weeks. We were told it was unlikely to have any changes this week. If there were to be any, regardless of which way, it would probably be another week before we would hear anything. We also have a new Secretary of Education. I'm sure you've heard. Ryan Stewart is leaving the state and going back to take care of some family responsibilities. We thank him for his service to our state and working with us over the last 2 years. We have a new Secretary of Education. His name is Dr. Kurt Steinhaus, and we've known Kurt a long time. He is the former superintendent of the Los Alamos School District. And one of the things that's really interesting about his experience the last couple of years is he has been very involved with the National Lab in Los Alamos related to all of the research and study related to COVID. And so he has been in kind of that inner circle in terms of the researchers and the information that the labs have been able to pull out. So he's in kind of a unique position. He's been a school superintendent. He's been very involved with the lab initiative, but he's also worked at the public ed department and under the governor in the past. So he's very familiar with our government, with the public ed department, and with our school districts. And so we wish him well. We're very excited to see what direction he will be taking the public ed department at our state. But I know, having worked with him for many years, he's a very good man and cares a lot about students and really wants to do good things for our students and our state. Our goal as a district right now is to do our very best to keep the infections down and be able to keep our school districts open. And so everything we think about, everything we do, we really have that mindset of how do we keep infections down and keep schools open. So this summer, we have, as we did the summer before, we have had thorough cleaning of our buildings. We have had all of our filters checked. We are using the most powerful filters our equipment will handle. We have done extensive cleaning, and we have done everything that we know to do to make our schools as safe as possible. And so people have been very, very busy. But again, what we're focused on is how do we keep those schools open? How do we keep infections down? The one thing we want more than anything else is to be able to stay in-person learning for those who want it. One of the current trend data that we have right now, we are seeing cases are increasing again in New Mexico and Sandoval County. But Sandoval County is not considered a hotspot at this point. And, that data came from the DOH, Department of Health website. And so that's good news. Another piece of really good news is that Sandoval County has a 70% fully vaccinated rate, which puts us as one of the safest counties in New Mexico. And so that's something that is also a positive. We do know, though, that most of the new cases, almost all, but most of the new cases are all of the Delta variant. And we know that variant is the most infectious of all of the COVID-19 strands that are out there. We certainly do have some beta and some gamma. They're all present in our state, but it's really Delta that we're most concerned with right now. We were very much surprised by CDC when they came out and said that they were now recommending all personnel and students wear masks. But we don't know at this point if the public ed department is going to follow that or not. In some cases in the past, they have followed CDC guidelines, and other times they've not. So we really don't know where they're going to go with that. But some of this is certainly driven by some states that are seeing very large increases in the number of cases. And New Mexico is seeing a rise, but it's not an overwhelming rise that's occurring in some other places. So that's really good news for us. There are some concerns. We've all been receiving your emails. I've received some. I know many have gone to the board. There's been a lot of communication the last few days. We appreciate you letting us know how you feel. And we certainly have looked at those and read them. The ones that have come to me really have focused around the concerns of how do you enforce the mask mandate, and concerns about singling out students or staff, and their concerns about medical privacy. And so I've had several people contact me about that. Concerns that the identification of vaccine status might lead to confrontation and bullying among students themselves, worried how we might deal with that and what would be the steps we would take to avoid that. One of the ones I've heard a lot from our staff is their concern about the loss of instructional time needed to enforce these mandates, puts them having to take time away from teaching and learning. They feel they have so much to do this year. They're really excited about the coming back to in-person learning and concerned about taking too much time away, not only from math, but other things that might keep them away from their students. And then some of the individuals said, I went and got my vaccine in anticipation. I have a little bit of a froggy throat today. In anticipation of not having to wear a mask. And they feel that's a backtrack on the commitment that they received when they got the vaccination. And then, of course, I've heard from some who are just simply opposed to masks completely. So I want to just talk a little bit about what the parameters are that we have to work around as a school district. And in school districts, we are a very interesting entity in New Mexico. We certainly belong to the community, but we also belong to the state. And so there are certain things that are under local board control, and there's some things that are under state control. And so we're not like all other states. And I've had conversations with some people about other places they've been, and honestly, our system doesn't work quite the way that the one they were coming from did. The right now, the mandate from the state is that all elementary children will wear masks if they come to school. And that's because children have not been vaccinated. The vaccine is not available to children under ages 12 or younger. And therefore, because there's almost no vaccine protection, that everyone, including the staff, will have to wear masks if they are in the building. So that's all staff, and that is students. I do want to really stress that there's been there continues to be a totally remote option. We have a new Spark Academy. A lot of the teachers that worked with this last year, really wonderful, creative, did a great job, and they elected to stay on and start a remote academy for elementary. And that academy will operate out of Joe Harris Elementary School campus. It will be 100% remote. And as of right now, we have a very good number, about 198 who have signed up. But that was yesterday, and having talked with Janice Chenault this afternoon, said a lot of additional requests have come in today. So I think we're going to definitely have a very sufficient enrollment to offer that academy and to offer all of the supports that would go with a remote academy. And so I think we will be well over that 198 before school actually starts. I've had some people ask me if we still have a hybrid option. We do not. Now there's only really two options. And so it's either in person or remote. And that certainly is the choice of the family. And we respect either of those two choices. We think we can deliver a good program with both. Secondary is a little more complicated. Our middle schools and high schools, mask at the secondary level is determined by whether you're vaccinated. And if you are voluntarily willing to reveal your status, you're not required to do that. But if you don't provide it, then you are still required to wear a mask. So you have to provide the documentation, and you also have to be willing to show that documentation if it's asked. So if the school nurse were to ask you for it, you would have to provide the school nurse that information, or another administrator. The other thing the system has to do is quickly identify those who are eligible to go without a mask. And so one of the ways I think that will be accomplished this year, not the only way, but one of them will be seating charts. And the state and the district are requiring that all staff, all teachers have a seating chart. And it's not just related to masks. It certainly is related to our ability to quickly identify who's been exposed when we have to quarantine the students. And yes, quarantining is still here. We will still have the requirements for close contact, but they have been loosened considerably. And we will not see as much of whole classrooms, whole wings, whole buildings having to be quarantined anymore. And so that's really, really good news. But everyone will have to have in the classroom a seating chart. And then our staff has the responsibility to enforce the system that is required by the state and whatever is approved by the board. So they do have a responsibility to do that. And I think, as I've shared with you, some have some concerns exactly how that process is going to work, and not wanting it to cut into any of that very valuable, very precious instructional time. Our first option is going to revolve around the mass pass. And Beth Pendergrass, our Chief Communications Strategy and Engagement Officer, is going to present a plan that we believe will meet the requirements of the toolkit. It is the least restrictive option that we have within the parameters established by the New Mexico Public Education Department. And it doesn't totally eliminate the identification of students and staff, but we believe it greatly minimizes it. And there was input from all of our middle and high school principals who are the ones that are going to have to make this work. And they all agreed that this was probably the best option for option one. And then option two, of course, is to require masks for all who are in the building or classroom. Some districts are requiring masks only in the classroom. Others are requiring them to be worn whenever you are inside. And, it's, you don't have to wear them when you're eating or drinking. There are several districts across, I'm just going to name two, but there are a good number of districts across the state that are requiring masks for all. And that's the Albuquerque Public Schools and I've sure got a problem with Los today. The Los Lunas Public Schools. And then there are many others that are still struggling with this issue, just like our district has been discussing what's the best way to go and have not decided as of yet. But there are a good number that have gone both directions. And so, like with everything else, there's communities are divided, people are divided across the state as to what's the best thing to do. And then the other, I just, want to say, we all know it, we've experienced it for the last 15 months, but everything could change again when the new CDC guidelines come out. The other is we've been told that if the number of cases start to rise to a certain level, then it's possible that we could go back to much more severe restrictions. So as I said earlier, it's in everybody's best interest to try to keep the numbers down. We want our kids to be able to come to school if they want to be here. And we want to stay open if at all possible and offer that option. And we want to continue to offer the option to those who want to be remote and respect the parents' choice not to be in-person learning at this point. And then last, I mentioned this before, sometimes we get a new audience and we have new people. There are, school districts don't have the option of deciding which rules we're going to follow and which ones we don't. So we must meet the minimum expectations, and there are consequences for districts and individuals who do not adhere to state requirements. And I've had people say to me, well, why don't we just go our own way? Why don't we just do whatever we want and just ignore the state of New Mexico? And so there are a lot of reasons why that won't work very easily, but I think the one that is most prominent is that 98% of our school funding for operations comes from the state of New Mexico. And so money raised by local taxes, and you say, well, I pay taxes, you do, and particularly the taxation for facilities and technology that we use to build our buildings. But you can't use that for anything operational. You can't use that for salaries, which is 90% of our budget. You can't use it for utilities. You can't use it for any of those things, not supplies, materials, books, nothing. So 90% of our funding is determined by the state legislature and comes from the state of New Mexico. And so if you decide you're not wanting to be part of that, we would end up having to come up with a way to raise taxes independently, and you're not allowed to do that either. So it's just, I wanted people to understand, because in some states, your money is raised locally, 100%, but that's not the case in New Mexico. So the other thing is that we can start with a least restrictive model, which is one possibility, as long as we stay within the parameters of the toolkit. But we can also move to a more restrictive one later. If we have the cases starting to rise and we started seeing a lot of problems, we could shift to go to something that's more restrictive. And then last, our courts in New Mexico have determined that public health orders have the force of law, and they are to be considered as such, and certainly have the ability to be able to direct all entities on certain types of things they can and cannot do during the pandemic. So I just wanted you to kind of review what the structure is in our state, but we definitely are dependent upon the state. There's one other thing I didn't put in there too, and the other is New Mexico in general, and our district is just like all the others. We are dependent upon federal money. We could not operate without it in New Mexico. We could not operate without it in this district. It would affect our ability for food services, a lot of the funding we have for children with disabilities and otherwise. So federal funding is also an important component, and is also tied into some of these expectations. And I'll close by just saying this. I don't know, I really hope that masks are not going to dominate the conversation this year. Our children deserve to come back and have a wonderful school year. We are so eager to have them come. We are so eager to start a year. We want it to be such a good year. Our children have had such a difficult time, as have our families, our staff. Everyone has been touched by this. But we really want to start this year on a positive note. We're excited, very excited to have our students back. And regardless of which way the family chose, whether it was in person or virtual, I can tell you we have so many wonderful experiences planned for us both this year. And we want them to be able to take advantage of that and move their education, their learning forward. And we are looking forward to having a wonderful year with our students and staff. We thank all of our families. We're so glad that you are back this year, and we hope that it will be a very great year. And I stand for any questions.
Okay, thank you, Dr. Cleveland. Are there any questions from the board? If you want to just raise your hand and let me know, or you can hold them until we get into the presentations. Okay.
No questions at this time.
All right, thank you. Okay, thank you, Dr. Cleveland, so much for your comments. I appreciate that. Noreen, you didn't have anything, right? I just saw you popped on. You're good. Okay. Okay. I'll get back to my notes. Okay, so for our next item, we will go to approve the prioritized agenda and propose time allocations. Any questions, comments on the prioritized agenda as it's been presented? Is there a motion to approve?
This is Board Member Jeff Morgan. I make a motion to approve the prioritized agenda.
Okay.
This is Board Member Noreen Scott, and I second.
Okay, we have a motion by Jeffrey Morgan and a second by Noreen Scott. Kim, can you take a roll call vote for us on that?
Yes, ma'am, I can. Vice President Morgan.
Yes.
Secretary Scott.
Yes.
Board Member Cullen.
Yes.
Board Member Coleman.
Yes.
President Galbraith.
Yes.
That is 5-0.
Thank you. The motion carries. Okay, for our next item, it's our public comment. These are those who wish to give the board public comment. We have a form on our site, and we received quite a few this in the last week. And so I'm going to go through all of our public comment. We got a total of 25 this time. And I tried to go through like I normally do so I can summarize those. We did get a number pretty late, but I also went through and read through those, and so I have those as well. But if you'll just be patient with me as we go through those. So we have, like I said, 25 we got from Angelina Nunez. She asked why students at Rio Rancho Cyber have not been issued Chromebooks while other students in the district have them. Jeremy M. asked for no critical race theory to be taught in school, and also that everyone wear masks or no one wear masks, so that we can keep people's privacy. Kristen Danielle, she stated that the reentry plan is ridiculous and unhealthy for our students to wear masks, and that there's side effects to wearing masks, and wants the board to push back on the state with its mandates. Jennifer D. Gregorio, she vaccinated her child so that they could go to school mask-free this year, and is asking that we don't punish vaccinated students, which she feels is the majority. Nicole Shaver asked that at a minimum that unvaccinated students are masked, and that we actually go ahead and have all students go back into masks per CDC guidelines. John Morlock, calling for masks would be a regression from our current public environment. I'm concerned about a violation of private and medical rights and thinks we should drop the mask requirement. Colette Allen asked that all masks or no masks and not to segregate our students. We received 2 from Cheryl Daniels stating several states are not requiring masks for anyone, including districts around our state. That districts around our state should declare a cease and desist to the state, and it should be up to families. She's also worried about bullying if some students have to wear masks and others don't. Danny Mayers, reconsider masking all children for COVID-19, and the Delta variant is less dangerous for them and less contagious for children under 12. Preliminary statistics from last year indicate that suicide rates in minors have risen possibly to 24%, have risen 24%. There's also an increase in mental disorders and asking us to not give in to fear. Paula Renton, could teachers teach without masks if they are socially distanced? Lauren Waits, mandated universal masking in elementary school puts us out of compliance with FAPE and IDA. In special education, it's especially difficult for those students that are in speech language therapy, and that we should have something on their IEP with agreements from the families that allows them to take off their masks during their therapy sessions, and that proof of vaccine should not be publicly displayed. Sorry, if I had this before we just got so many, then I would have summarized them a little bit differently. But Travis Brown, mask the students. Let's see, massive students, their family has an immunocompromised family member. Kelly Boyles asking for no CRT, which is critical race theory in schools, no masks for students, think state and public school system is correct. Kyla Murphy, no CRT in schools, critical race theory. Julianne Garcia, no critical race theory in schools, no mask mandate. Jean, I'm sorry, I'm going to say your last name incorrectly, Reffenberger, no masks in schools, also concerned about critical race theory. Patricia McHale, no masks, no critical race theory. Monique Brown, students should all mask. Janae Carr, students should wear masks. Melinda Kincaid, masks should be a choice, not a mandate. Stephanie Andrews, no critical race theory in schools. C. Ray, that we should have no masks. I think I missed these two. April Marker, she has a personal stance that no child should be masked, but because of the guidelines, she believes that all students should be masked to avoid any segregation, and is also concerned about segregation possibly in lunchrooms. Katie Hanna, why are there so many inconsistencies with reopening our Rancho public schools? Some schools are doing in-person meet and greets, assessments, and open houses, and others are only virtual, saying that they're following health protocols. There should be equal opportunity for parents and students district-wide. That is all of the, I believe I got through them all. Those are all of our public comment for today. So
Board Member Noreen Scott, thank you very much for doing that. You really did an awesome job. Thank you.
Thank you. Usually when we get a large amount, I try to just summarize them with numbers, but because some kind of came in late, it was difficult for me to do that. But I do want to tell all who are watching and who may watch this later, we are grateful for the public comment that we do receive. And anyone who wishes to give public comment, please go to our RRPS board page and submit the form there. We read each and every, as you can see, I read each and every one of those comments today so I could summarize them to you. And so we're grateful for those public comments. Okay. Next is for our reports. So we have a facilities update on Colinas del Norte Elementary and also Mountain View Middle School. Melanie Archibek, our Executive Director of Facilities, is here to present.
Good evening, Madam President Galbraith, members of the board, and Dr. Cleveland. As you said, I'm Melanie Archibek, Executive Director of Facilities. So before I get a little bit into the actual projects, Colinas and Mountain View, I just wanted to take a broader approach on how we look at projects. So when we start to look at projects for the summer, we assess everything that is required. We have items that are considered long lead items. And so that's something that means it's going to take a long time to order from when we actually get it. HVAC units are typically 8 to 12 weeks. And so we bid out accordingly so that we're ahead of that schedule with intentions to have the units on site as soon as the students are out on summer break so we can really maximize the summer. So that's what we did going into the summer. We were very optimistic, started early, ordered everything. What we didn't foresee was the unforeseen and the volatile nature that we're seeing right now with the COVID implications in terms of delays and shortages in materials. So the two schools, Colinas and Mountain View, are the ones that we're starting remote because we currently do not have all the HVAC units in. What we're saying, and that's not the only items that we're seeing are delayed or not in. The other ones we can manage. We do our best to work within the issues that we have, but there's nothing we can do when we do not have HVAC units. So I'm going to start with Colinas. and kind of tell you where it's at as of today. We are doing HVAC replacements on 4 of the buildings. It also includes interior renovations and some roof work. 3 of the buildings are looking really well in terms of the interiors. We're hoping to have those complete by the end of this week, and then go ahead and start moving. Again, that doesn't have HVAC units. The last building, which is building 4, we're about halfway done with the interiors. And we're hoping to complete that interior-wise by the end of next week. And then we'll start moving in and allow the staff to come in and set up their classrooms. What we're doing in anticipation of not having all the HVAC units. So today we actually had 8 arrive out of 28 needed for that school. And so we have ordered temporary cooling units. Those have arrived. Those are being installed in the classrooms. And then we are also putting the HEPA filters that we put in all the classrooms last year. We're making sure that they're in these rooms as well. Our hopes are that by the time, and I say our hopes because I have no confirmation, we've seen on some of our delays them being pushed back 4 times this summer. So I can't tell you with full confidence when we'll actually get all of them, but we're hoping that we will have them by the time the kids come back. In the situation that we don't, as I said, we do have those temporary units. They are here, they are being installed, and we have the HEPA filters installed as well, so we can be prepared for that. So that's where we're at with Colinas. Mountain View Middle School experiencing the same type of delays. The finishes are a little bit more extensive there. So as of today, they were polishing all the floors and kind of finishing up interiors. But there's a little bit more work required on interiors. We don't have any HVAC units that have arrived at that. And it's kind of hit or miss. Some of our other projects that we've had, we have all of them come in, some of them, none. We're just kind of subject to what I will say this volatile implications of COVID. And I wanted to read kind of one of the letters that we received from the contractor, just so you can, and this is very consistent that we're getting on all of our projects, but due to nationwide shortages in raw materials and a global surge in construction activity following the COVID-19 pandemic, the construction industry is experiencing unprecedented impacts to the supply chain for the construction equipment and materials broadly. And so on some of these, when you think of systems like HVAC units, it's multiple components that are in. So perhaps everything could be there but one component. The major delays that we're seeing is roofing materials, duct detectors, of course, the rooftop units controls, but we can manage everything else. We saw some lighting delays, but we just supplemented it with other lights, but we'd really like to get the actual units in. So beyond bringing in temporary units, we're just kind of subject to when they arrive. I stand for any questions.
Thank you, Melanie. I know it's got to be so frustrating right now trying to get all these things in. So we'll go ahead and I'll just call out names. Jeffrey Morgan, do you have any questions for Melanie at this time?
I do not. Thanks for the update. Greatly appreciate that. I was going to ask what was the delay, but Dr. Cleveland kind of alluded to that earlier about supplies being a shortage because of COVID. So when you said that, totally get it, totally understand. Thank you.
Thank you.
Yeah. Catherine Collin.
Thank you. Melanie, so you're saying that you're bringing in these temporary units for cooling. So are we renting those? And what is the cost of these? Because we must be bringing in a lot of cooling units.
No, so we're actually purchasing them. My intent is to roll them over to the next large project, which we have. We've started design on Rancho Middle School. And unfortunately, you guys understand how large the HVAC replacement projects are. I think we'll be able to use them over the years until we can continue replacing everything and then just start the cycle again. I want to say that we've spent about $36,000 in temporary units, but it's quite a few units. We already had HEPA filter units from last year. We received a grant. So we spent that down and kind of put those out throughout all the schools.
Okay, thank you.
Mm-hmm.
Noreen Scott.
No questions at this time.
Okay, and Wynn Coleman.
Melanie, thank you. I know that you talked about bringing in the alternative systems and anything worth, I'm just wondering about the safety with the filters and things like that using those units if we are putting our students at a higher risk. If you can just kind of talk to that, and I apologize if you had addressed that and I just didn't catch it.
No, that's a really good question. So the toolkit, what it has is for the spaces. So we have units that cannot accept MERV 13. If you kind of remember all the rating discussions last year, we have units that just can't support that. So we're doing the highest possible. The reason that we got the funding in the grant is the state put it out there that for any, and this is one of the requirements, if your unit does not support MERV 13, you put in the highest rated that you can get in there and have a HEPA filter. So we're putting in the temporary units and the HEPA filter to assure that the spaces are safe and are meeting the requirements so that we can bring the kids back. Does that address your question?
Still there, Wynn? Oh. We're going to go with that. We're good, Melanie.
Okay.
Thank you. How are the teachers and the staff and the schools feeling? Are they feeling like this is going to be okay as we use these kind of units and everything else, or is it going to cause any sort of stress as we start to try to get the kids back in?
Jana, do you want to? I haven't heard anything specifically from staff. The principals are aware of what we're doing, and I don't know, Jana, if you can speak more to that. But the feelings of the staff.
That's okay.
No, I haven't heard anything particular from the staff.
Okay.
I think at Cleanest, they have a really good plan.
That's good. Okay. All right. Dr. Cleveland, did you want to say anything?
Well, I would just have to say, this is our first day back. So we really haven't had an opportunity. The real test is going to be when we get students back in.
Mm-hmm.
And generally, I think with staff, there's few in the building, and we'll have a better feel for that. But I know that Melanie's looked into all of that in terms of the number of units, how to place them, and I think it's probably the best that we could possibly do, given the constraints that we had. But we really haven't had a lot of time to be able to really see how it's going to work. But I would just add, I think, based on what Melanie has said, we've always needed cooling units. Every year we've ever opened, we've had to have them. Air conditioning, it goes out in one portable or it goes out in one wing. We just have always had some issues as we start back up. And I think those units will be put to good use. As Melanie said, we've got several years still to go in terms of some of the installations, and they will be used every time we need them. So I think, we wish we didn't have to invest in it. I mean, we really wish we'd have to spend the money for that. But I think it's really clear it's not a waste at all. I think it'll be something we will use over and over.
All right. Thank you. Thank you, Dr. Cleveland. Anyone else from the ward? Anything else? Any other questions? Okay. Thank you so much, Melanie. We appreciate you coming on and giving that report.
Thank you.
Okay. Okay, for our next item H, we're going to approve the consent agenda. Are there any questions, or is there a motion to approve the consent?
This is Secretary Noreen Scott. I move to approve the consent agenda.
Okay.
This is Board Member Jeff Morgan, I second.
Okay, we have a motion by Noreen Scott and a second by Jeff Morgan. Kim, can you take a roll call vote for us?
Yes, I can. Vice President Morgan?
Yes.
Secretary Scott?
Yes.
Board Member Cullen?
Yes.
Board Member Coleman?
Yes.
President Galbraith?
Yes.
It's approved 5-0.
Thank you. Motion carries. Okay. Moving into our business portion. So for our first item under business, we will consider the approval of the unapproved RRPS regular board meeting minutes for July 26, 2021. Are there any changes or anything that needed to take place on that, on those minutes that anyone saw? Okay, do we have a motion for approval?
This is Board Member Jeff Morgan. I make a motion to approve I'm sorry. The July 26 minutes. I'm trying to look at my screen and see this at the same time. But I was also trying to, okay, no, I'm for that. That's it. I'll make a motion to approve the July 26, 2021 minutes. Thank you.
Thank you. Do we have a second?
This is Board Member Catherine Cullen. I second.
Thank you. All right, we have a motion by Jeffrey Morgan and a second by Catherine Cullen. And Kim, can you take a roll call vote for us?
Yes, Vice President Morgan.
Yes.
Secretary Scott.
Yes.
Board Member Cullen.
Yes.
Board Member Coleman.
Yes.
President Galbraith.
Yes.
Approved 5-0.
Thank you. Motion carries. Okay, for our next item, it's to consider the approval of the RRPS recommendations for meeting certain requirements within the PED COVID-19 response toolkit, including mask requirements. We have Beth Pendergrass, our Chief Communications Strategy and Engagement Officer. We also have Sherry Carver, who I'd like to say welcome, Sherry Carver, our Executive Director of Student Services, here to present.
Good evening, President Galbraith, Dr. Cleveland, and members of the board. I am here with you again a week later to talk about information in regards to COVID-19 guidelines around mask wearing, and particularly in the secondary schools. And as I mentioned last Monday, and as Dr. Cleveland alluded to, this is a very divided topic. As Dr. Cleveland said, we have heard from families and staff members who believe everyone should wear a mask. We've heard from families and staff members who believe that no one should wear a mask. We've seen the protests. We've received articles on either side of the mask debate that attempt to dispute and discredit other side's science. So, I mean, it's really hard to know what is best in this case. And I can really truly say there's only two things I'm 100% certain of right now. And one is that there's no way we can make everyone happy in this. And the second thing I know 100% is that we have to work within the parameters of the New Mexico PED COVID-19 response toolkit, which allows for some flexibility, but not much. First slide, please. So I'm going to reiterate a few points that Dr. Cleveland made. One, everyone in elementary schools is required to wear masks. In secondary schools, students, staff, volunteers, and visitors who have provided evidence of full vaccination are not required to wear masks. Based on the needs of the community, secondary school administrators may opt to make mask use universal. Students who choose not to wear a mask must provide evidence. Next slide, please. There's no requirement for fully vaccinated individuals to disclose their vaccination status. Schools that accept voluntary submission of documentation must keep it protected. Secondary schools are required to develop a system where we can easily verify whether an individual on campus has provided evidence of vaccine. So Dr. Cleveland went through those, and I just wanted to touch on those briefly. Next slide. Again, as Dr. Cleveland mentioned, the new CDC guidelines recommends universal indoor masking for all teachers, staff, students, and visitors to K-12 schools, regardless of vaccination status. We anticipate that the NMPED toolkit will likely change to reflect this guidance. However, we have not seen those changes yet. Next slide. So I am going to take you through our options. And like Dr. Cleveland mentioned, we did meet with all middle school and high school principals, and we discussed everything from the comments that we're receiving from parents and staff members, the likelihood of the toolkit changing, having to monitor the mask wearing, teachers having to police masks, the issues with identifying vaccinated versus unvaccinated, the fairness between elementary and secondary, the possibility of students who might treat other students differently, regardless of either side, right? Those who got vaccinated so they wouldn't have to wear a mask, our county's current COVID-19 numbers, concerns over the Delta variant, and I could go on over all the different things that the principals kind of talked about when they came up with these two options. Next slide, please. So option one, we're calling the mask pass. This, of course, is for secondary students only. Vaccinated students who do not wish to wear a mask may request what we're calling a mask pass. A form has been created for parents and guardians to complete that allows for them to upload the appropriate vaccination evidence. Next slide. This is just a snapshot of the form. Essentially, this form would only go to 1 to 2 or 3 confidential administrators or nurses within each school. Next slide, please. Once the form has been submitted, each school would distribute the mask pass to the student through a method of their choosing. Students must have the mask pass with them each day and show it to administrators, teachers, and bus drivers, etc. If they do not have their pass, they'll be asked to wear a mask. Schools will have masks available for students who forget their mask or their mask pass. Students in masks could be those who are vaccinated but choose to wear a mask, those who forgot their mask pass, or those who are unvaccinated. So we felt it makes it a little less distinguishable in regards to those who are vaccinated or those who are unvaccinated. It really puts the onus on the students who do not want to wear a mask to make sure that they have their mask pass. And essentially they can have it out as they walk into a classroom and show their teacher. Their name would be on the back of it. And so we know whose card it belongs to. They should have the card with them as they go on the bus. If they don't have their card, then they wear a mask that day. So it really kind of helps counter the idea of knowing who's vaccinated versus who's not vaccinated. In addition, we're learning that a lot of students who are vaccinated are going to still choose to wear their mask. And again, like we said, no masks are required outside for any student, and that's for elementary or secondary. Our timeline, if this is the option that's picked, we would send the form to families tomorrow. The mask passes will be printed and distributed to the schools. Schools would work to get their mask passes distributed as quickly as possible, understanding, school's starting and we'd be working as fast as we could. So students would be asked to wear their masks until they got their pass. Next slide. For the staff members with this option, staff members who qualify, who do not want to wear a mask, would upload their vaccination verification to Talent Ed. And this is what they've already been doing to opt out of surveillance testing. So this is not new to staff members. A mask-free request form would be sent to staff members to complete, including verification that they've uploaded their vaccine to Talent Ed, and allowing HR to verify their vaccination status with their administrator. Once they've completed that form, then a list of approved staff names would be sent to the principal or supervisor so they know who can go without a mask. And then, of course, option 2 is masks for everyone. And so there's not a lot involved in this. It would be the same as elementary. Everyone in the secondary schools would be required to wear masks. Next slide. And just as a reminder, districts can adjust as needed. You could increase based on your substantial or COVID-19 transmission in the school. So we would start tracking those numbers, of course, like we did last year when school starts. You can change it based on increasing transmission in the community. So Dr. Cleveland already went over the current Sandoval County numbers, so they're there again as well. But we could continue to monitor those numbers if the board chose to start less restrictive and then restrict it more. If we find that it's difficult to enforce, then we could change that as well. Or if we hear more from the community and the board gets a feeling that we should move in a direction other than what you select tonight, then we could adjust as well. Next slide. So I'm going to turn it over to Sherry to go through her portion, and then we can stand for questions.
Good evening, President Galbraith, members of the board, and Dr. Cleveland. It is great to be back. Thank you. So let me just start with what the toolkit says on the mask policy, the guidelines that we have to follow. That schools will update their student discipline matrices or add an addendum for the upcoming year and describe the consequences for violating non-compliance. And the school policy will set forth the number of times a student may remove a mask and receive a warning. If you'll change the slide there, thank you. And then last, families must be provided a notice of the updates by September 1st, and schools will collect signatures from families indicating receipt of the revision. We do have a plan to send out the notice to parents and collect those signatures electronically. After visiting with the principals, we have decided on an addendum as our choice to notify parents. If you'll turn it to the next slide, there is the addendum that we have come up with. Again, as Dr. Cleveland said, you know, we want to keep kids in school. We want to keep kids in the classroom. So we're not going to just assume that they're refusing to wear a mask. We will approach the students, ask them if they forgot their mask. And if they did, we're going to provide a mask to them and remind them to bring their mask in the future to school. If they're not wearing a mask or they're wearing it improperly, we'll again remind them to put on the mask and remind them about the correct way to wear the mask. But as this slide says, if you know, the student is refusing to wear a mask, then we are going to have to send the student home. And then the school administrator will contact the parent or guardian to discuss the mask requirements for in-person learning. And we want to give parents the choice to either remain in person with a mask or the possibility of transferring their student to our virtual options. If the student remains or chooses to remain in person, they must agree to wear the mask. And if she refuses again to wear the mask, the student will be automatically assigned to our virtual learning. And the last part of this is the placement will be reevaluated at the end of each grading period. The second slide there on the addendum is what I mentioned at the very first. You know, we want to keep kids in school, so we're going to assume that they're not just refusing or choosing not to wear the mask. And we will provide a mask, clean mask, and ask them nicely and, you know, educate them on proper mask wear. But that's the addendum that we discussed with all of our principals and decided to propose tonight to you. And with that, we'll stand for questions.
Thank you. Before I go to questions, Dr. Cleveland, did you want to add anything before I go to the board, or should I go directly to the board?
Well, just a reminder that this applies only to those students who have not provided documentation and are not required to wear a mask at all. This only applies as addendum to those who do not have that documentation in place.
Okay. Is this the whole, this is the whole presentation, right, Beth, as I go into questions, right? Okay. Just want to make sure. Okay, so we'll go ahead and start with questions. Noreen Scott.
Yeah, how easy is it to replicate the mask pass?
Well, you know, it's certainly something that someone could always do. We have them professionally printed. We gave a couple samples to our board members, and then the labels that are printed from Power School are actual Power School labels that would be on the backs of the cards. So I don't want to say it couldn't be done, but it would be difficult, I think.
I'm sorry, Beth, I didn't see a copy of the mask pass. Oh, I guess just if you're there in person, you can see it. So Catherine, you're looking at it. Could you see them being replicated?
Well, they're not easily replicated by the paper. Would it be on the same type of paper it is, Beth?
Yes.
Yeah. So it's not like you can just, I mean, I guess you could. I mean, somebody could replicate it. I mean, people replicate money. So anybody could do it if they want to. But it is on a different type of paper. But of course, they will still have at the school who's vaccinated, who's not. So if they have any concerns that somebody might have replicated it, they can check with the nurse's office. Correct, Beth?
That is correct.
And if I could just add one thing that Beth said, there's a label that comes out of Power School, and that will have to go on the back. And that would also be somewhat difficult to replicate. So you have to have both.
Thank you.
Catherine, you have any questions? Discussion?
Dr. Cleveland, how many did you say what was the percentage that's vaccinated in Sandoval County? Was it 70?
70%.
70?
70%, 70%.
Okay. And then the other question is one of the public comments that we did have that I was curious about is with speech therapy in the elementary schools. Will they be able to take off their masks to do speech therapy? Because of course, you know, that's a big part of being able to see what they're doing.
I would have to check into that for sure. And if Jerry is on, Jerry, feel free to add. There are provisions that are made in IEPs for students with disabilities. If there is a decision by the IEP committee and Jerry's on by the physician, a student can temporarily, I believe, be excused from that. But Jerry's the expert on that, so let me turn it over to him.
At this point, for let's say elementary students, I don't think we're still able to do speech therapy without masks. We do have some students that have a mask exemption. So it would be with those students, but then the staff are required to wear additional PPE. You know, if we're looking at students at the middle school or high school level that have a mask pass, then again, it's not an issue, but last year we did buy lots of screens and so forth, but I still think we have the 6 foot or even 3 to 6 foot mandate. So I don't think we are allowed to at this point. And the state hasn't come out with further guidance.
Okay.
Can I add just one thing or ask a question, Jerry? Can they not be behind a screen very much like the board has, where they can see the teacher and the teacher can see them? As long as there's a physical barrier there, I believe the mask can be removed. And I don't know if we have enough of those. And the other question is, so much of speech therapy today has gone online anyway. A lot of it is. And so the two-way visual gives a pretty good indication of where the mouth or the tongue should be when you're attempting to pronounce some words. So I know that a lot of speech therapy is done that way today. We still really value our speech therapists and want it to be an in-person experience. But I would assume the plexiglass is just fine if you have a plexiglass between the student and the teacher.
We did ask that last year, and we were told no, that they still had to have the 6 feet. But I think if we do have the barrier and then 3 feet between each of them, I believe we can.
Well, so, this year the guideline, and Beth, correct me if I'm wrong, the guideline is 3 feet for students, not 6, I believe. Isn't that correct?
Unless a staff member is involved, then it's 6 feet.
Why is that? So if it's a student, it's 3 feet, but right. if there's an adult teacher, then it has to be 6 feet. Okay, that just makes so much sense. Yeah. Okay, wonderful guidelines by PED again.
Well, you can explain it to us later because we'd love to know.
Exactly. Okay, and then, you know, there was with a lot of the comments that we've heard from the community, I know that a lot are just, in Dr. Cleveland, you had discussed this as well, just don't abide by the guidelines in PED that they gave out. And the public needs to know that we have to do these. With secondary, they must wear their masks. There is a school district that voted to make it optional, and they now have to go back and look at that vote, because PED can remove a whole school board. And remember, when PED removes a school board, then they appoint who they want on that school board. So I just wanted to say that for the public to make sure that you're aware we cannot go against PED's guidelines on the elementary level.
Okay. All right. Thank you, Catherine. I'm glad you brought that up because I was I was hoping that that would come out. So thank you. And let's go over to Wynn Coleman.
Can you hear me okay?
I can. Yes, you're good.
Okay, it's just raining where we are. So,
Okay.
I have a question in regard to the circumstances where, like, I'd like to know how in secondary, if the decision is made that you do the where it's optional for the vaccinated students, how you're going to handle issues like lunch. And then also too, what happens when it comes to, for example, like the nurses, and if students are sick, and what are we going to have to put the students that have not been vaccinated in a completely different area? Are we prepared to do that? And what other situations do you as a district think that it could be an issue of having to completely separate the two different groups of students?
Thank you for those questions, Wynn. Those are really good questions. In regards to lunch, what the PED requires is that we have that whatever evidence readily available. So that would be their mask pass. So during lunch, any staff member could go and ask to see a mask pass, but really during lunch, students aren't required to wear their mask because they're eating. And so I don't necessarily see that as an issue. There are no plans to segregate students from other students due to their vaccination status. Essentially, the only thing that the guidance says is someone who's a close contact, if they're vaccinated, they wouldn't have to quarantine at home. But we would treat the case the same way as we did last year, where we would pull close contacts and have them sent home. And then if they were vaccinated, they would be able to return to school. But even that has changed because our close contacts is going to be different. It's no longer a full classroom. We're looking at far less individuals who would be considered close contacts. And so I just want to reassure the community and the board that we do not have plans to segregate students in different locations based on their vaccination status. I know there was some confusion, the PED put out a recommendation, one of which was, well, you could have unvaccinated students eat outside, or, they offered that as a suggestion, but that is not something that the district is planning.
And so just so I understand that if a student that has not received a vaccination is sick, showing symptoms that are consistent with the COVID virus, that they could be right next to a student that maybe has had their vaccine. I mean, so just so I understand, and I'm just trying to put it all in perspective, so that they'll just be in the nurses' station with their mask on. And then, if the decision is made to give people the choice, they'd be there with their mask on, and then somebody that's had their vaccine, if they don't want to wear it, then they won't be wearing their mask.
I'm not sure I understand. I think what you're asking is if they went to the nurse's office, if one would get to go without their mask and one with their mask.
If they were showing symptoms of COVID, and they're at the nurse's office, that they would just be there with all the other students and just with a mask on, if that's how the board voted.
I think for the nurse's office or for our care rooms, those standards would be different from anywhere else in the school. And our nurses would determine those COVID safe practices. But if an individual is in a care room, most likely any individual in the care room is going to have a mask on.
Okay, thank you. I just needed that clarification. In the care room, you're still, that will still be in place.
Correct.
Okay, just thank you for that clarification. And I don't have any other questions.
Thanks, Wynn. Dr. Cleveland, did you want to add on that one?
Well, it was stated. I just wanted everyone to be sure that that we still have our care rooms, which are isolated rooms from the nurse's office. Anyone showing signs of COVID would go to the care room, and so there's a natural separation, but it's the same one we used all last year, and it worked very well for us.
Yeah, thank you. All right, Jeffrey Morgan.
I have a question and a statement, comment, I should say. Beth, Sherry, I'm not sure who came up with the mass pass idea. I thought that was pretty cool. That's pretty creative. I'm not sure who came up with that, but whoever it was, tell them thank you. And board member Noreen Scott had asked about being able to duplicate that, and we discovered it looks like it's going to be hard to do. Who's going to verify the vaccination cards that has to be turned in and submitted with that form that you showed?
So those forms will be submitted to administration and to the nurse's office, and the nurse staff have access to verify the vaccination records.
Because those can be duplicated as well.
Yes, sir.
And the reason why I know that, because I have two. Well, a lady made a mistake and she corrected it, but that's the reason why I'm asking. Those cards could be duplicated and copied, falsely signed. So I just want to make sure that whoever's going to be verifying this, that they are verifying that those vaccination forms are accurate. So I think that's important as well.
There's a state registry.
Okay.
From Oregon, which is the official DOH registry. And the nurses cabinet, it can check, anyone can check actually, who's on that list. The only problem with using that list alone is that not everybody is on the list. And there are some exceptions on how people have gotten vaccinated. For example, some people went to other states, especially people along the Texas and Colorado border. They had vaccines early and they crossed the state and got vaccinated. They're not in the New Mexico DOH. So there are a few that are not in that list. So it's got to be kind of a multiple approach. You've got the list, you've got the card. If one appears to be fraudulent, then we would follow up on that and verify whether it's accurate or not. But there are some cross checks and some ways to generally be very careful with that. And our nurses are aware of how to do that.
Okay.
I'm sorry.
Thank you.
And I would add to Vice President Morgan that if we do see a lot of people duplicating or trying to duplicate or submitting false records of vaccination, then the board certainly has the option to go to all masks. You know, if we see that it's not working, then the board could say, you know, we tried, you know, it wasn't successful. Folks didn't follow the rules. And so now we have to go to all masks.
All right. Thank you. That's all I have. Thanks, guys.
Vice President Morgan, I will have to give credit to Beth for the mask pass. She's so creative. We do ask that the community be patient with us because, you know, as you know, secondary starts right away. So it may not be day one that we're able to get all of those mask passes out, but we are certainly going to work at it and verify, you know, the vaccine and get those out as soon as we can.
I see Wynn has her hand raised. Go ahead, Wynn.
Yes, I'd like to direct this to the district attorney. Lauren, if you would speak to what we as a district need to be careful about in regard to privacy issues, which has been a big concern of mine. And as we're talking about things like this pass, and can you just maybe address some of the things that you have reviewed since this has come out?
Yeah, absolutely. Member Coleman, I don't think that there's anything uniquely new in this circumstance. We've always guarded medical information carefully. It's protected by FERPA, and that's going to continue to be the case. As we get information about who has been vaccinated and who hasn't, we'll protect and guard that information according to the law and the rules. With the mask pass itself, a person who has one doesn't have to wear it on their clothes. They don't have to show it to anybody except for an administrator at the appropriate time.
Good.
Thank you.
Okay. Before we go over to Catherine Collin, Dr. Cleveland, did you want to add anything before I saw your honest?
The one thing I would add, and just build on what Beth said, is And we really are asking for everybody's help to pull together to make this work. Because if it doesn't work, then we're going to have to go to something more restrictive, and none of us want that. So, if everyone will pull together and make it work, then I think we'll be able to continue to offer this option. But if we start seeing people are not following the rules and we're beginning to see an increase in cases, it makes it hard to be able to continue. So it's really just a plea from everyone to do your very best to make it work, because we're all benefit from it, if in fact that we do that. So the other is it's just a comment, and I know there are a lot of people that disagree with that, but it's been said several times, and Beth may have said it earlier. We don't have the prerogative to decide what rules we'll obey and which ones we won't. And you begin to think about a society where each one of us can decide what we're going to obey and what we're not, what kind of situation that could lead to. And so, we all work hard to change the things we don't like. That's part of our democratic system. If we don't like something, we go through the right process and we try to change it. But we are asking everyone to pull together, and not for the school district or not for our staff, but for the kids. Really, we want to be able to offer rich extracurricular. We want to have as normal a school year as possible. So we really need everyone to pull together and make it work. We're really asking for student and parent and community support to make this a good year for our kids.
Okay, thank you, Dr. Cleveland. Catherine Collin?
So you kind of mentioned this, Lauren, too, with Wynn's question. So with this pass, it could be kept in a wallet or something like that and then brought out to show the administrators. Is that correct? So they're not showing it anywhere on their IDs or anything like that?
Yeah. They wouldn't have to wear it. They wouldn't have to put it on their ID. I mean, I guess they could if they wanted to, but that wouldn't be a requirement.
Okay.
They could keep it in their pocket or their book bag for when it's needed.
And so I would assume that their teachers are not going to have to look at it every day. They'll probably figure out who's already, maybe once or twice just to remember who has it. And then, because I don't think they're going to be showing it every single day when they come in the classroom or at the school. Is that correct?
But I suspect that the teachers will probably get to know pretty quick who should be wearing a mask and who doesn't need to wear one. And of course, this is all a voluntary process as well. Nobody has to disclose their vaccination status. It's not required. However, if they want the benefit of not having to wear a mask, that is what is required for PED. That they'll have to demonstrate that they actually have been vaccinated.
Our secondary teachers, many of them have 150, 170 students. So they have a lot of kids. And I know some of them have talked about everyone has to have a seating chart. That's required this year. It's required by the public ed department. But, on that seating chart, you could very discreetly mark who needs a mask and who doesn't. And therefore, you wouldn't be asking to show it as you enter the classroom at all. The teacher would already know that after the first time. And so they're concerned about two things. I mean, they're concerned about not asking students for it as they come in so other students can see it. Mm-hmm. And they're also not wanting to waste instructional time to do that. It would slow down the start of class every day. So they will develop, I think, very effective ways of knowing who in their class has the pass and who does not. The other thing, though, is it will change. And there will students that will decide to get the vaccination and haven't had it. So the list will not always be static, but the schools will have a system by which you can update that. But I don't envision at all teachers standing in the hall and asking for a pass before you can enter their classroom. That would be a waste of time, but it would also be frustrating for everybody involved. So teachers are very clever, and they know how to work that. They'll find a way to make it as unobtrusive as possible.
Okay, thank you.
Okay, Noreen Scott, did you still want to say something?
Yes, I have a second question. Will all our teachers wear masks or not?
Sorry, you're a little quiet. You asked if all the teachers will wear masks.
Will they be required to wear masks?
No, so in the slide presentation, we talk about the staff requirements. They upload their verification to our employee portal called Talent Ed, and then they would fill out a form on their own that requests to be mask free. And of course, remember, this is secondary only because all of elementary is required to wear a mask. So middle and high school only. And once they request that and upload their verification and give permission, then the principal would know which staff can go mask free.
You're muted, and I was muted trying to tell you you're muted, but
I wasn't clear that that would work for all teachers then. So, okay, thank you.
Okay, and then Wynn Coleman.
Yes, and I would like Dr. Cleveland, if you would speak to, or anybody else administration-wise that could give some input in what I see as just a contradiction between, and I know it was addressed before, I'd like to hear it one more time. CDC saying that they encourage everybody vaccinated or not to wear a mask, and yet the public education department is passing this off as to the districts to make the decision and giving more freedom, which is
I can respond to that quickly, and then if anyone else wants to jump in. They had just delivered the toolkit, and they were not going to revise it within a day or two after it had already been distributed. They did make it very clear that they will continue to watch, and they are expecting to have some additional guidance coming from CDC related to public schools only. And they're waiting to see what that is going to look like, and if there's going to be any other additional requirements that are coming from that, and that they would only update it at the regular 2-week intervals. So it may very well be coming, to your point, it might be coming at the next, at the next public health meeting, but it might not. New Mexico has one of the better vaccination rates across the country. And one of the things they're looking at is what is the vaccination rate of that particular area and state. So in that area, we may qualify for a little less strenuous requirements, but we really don't know. But I think you make a really good point. There is that contradiction, and it's really frustrating for everyone because part of the time we follow CDC and part of the time we don't. And you kind of wish for some consistency in that. But I did receive an email from one of the deputy secretaries that said they were working on a revision to the toolkit. And so I don't know what that means, and there were no specifics, but I do have that email. So I think it's quite possible there could be some changes in a short period of time, but I don't know that one way or the other. And then to your last point is, yes, if they were going to make any changes, it surely would have been nice if it had been done before the start of school. And we kind of go down one path and might have to change it later on. But that's the hand we've been dealt, and we're going to deal with that. So, we have a plan up until the time. If there are any changes, we are moving forward.
When you have an additional, there you go.
Yeah. Yes. Do you know when it comes to I know that you talked about the percentage of the population in New Mexico that's vaccinated. What's the age breakdown? So do you know as far as the student age population that's been vaccinated in our state? I'm just curious.
We don't know, but we know it's over the age of 12, and that no child under the age of 12 has legally been able to receive the vaccine up till now. We've been told that probably we're 3 or 4 months away from a vaccine that'll be approved for younger children, but that certainly remains to be seen. So to your point, it's 70% of those that are older than 12. I don't know at all, but I've certainly heard in some of the meetings that I've been on, the number goes down as the age of the individual goes down. So a lot more seniors have had the vaccine than students who are 13. So, but I haven't seen any specific numbers about the breakdown by age, except for certainly age group for the older, because they have the vaccine first, they have access to it first, and the original COVID-19 was greater for older folks. One of the things that we're seeing now, though, that is troublesome is the Delta variant is attacking children in early teens, and it's a pretty severe case often if you get it. And so a lot of the things that we heard about the original COVID don't apply to the Delta variant.
Thank you.
Okay, thank you. Do we have further questions from the board? Anything else that came up? Any discussion that you want to bring up with in regards to the presentation? Dr. Cleveland, as you've been talking to teachers and principals, is your recommendation, I'm just curious, I know you gave us these different options and stuff, but where are you kind of feeling that is the right place for our district?
Well, it's like everything else. It's hard because you see, pros and cons both ways. But I definitely lean towards starting as lenient as we can and seeing if we can't maintain a really low rate of infection. Last year we did a really good job with that. Our buildings were clean, our staff were careful, our kiddos were careful, and we kept it even in the worst of times better than some other areas did. So my recommendation is that we start with what is less strenuous, but with a really clear understanding of everybody that if we're not careful and the cases start to rise, then everything is back on the table again, and we'll be back to the board and asking for reconsideration. So I would go with 1 for now, would be my recommendation. However, I certainly understand the districts that have chosen to do number 2, and it's certainly their prerogative. And so far, I think in the districts I've talked to, it's about 50-50 in terms of which direction we could go.
Okay, thank you, Dr. Cleveland, I appreciate it. Okay, go ahead, Catherine. Hey, real quick, hold on, Catherine. Sherry, can you mute your microphone real quick? You can hear me double. There we go. Sorry.
Okay, just so we can just start the discussion. I'm for the mask pass. That's where I'd like to start out. Of course, we can always, like Dr. Cleveland said, if it changes or we have some issues, then we can always tighten it up. But that's where I'm at.
Thank you, Catherine. I'm in that same place. So I though we're playing this game that we played last year, right? Where we make a decision and then, possibly a week later or even 2 days later, it can all change on us, which is unfortunate because everyone is so passionate as we receive all these emails, and then there's not a whole lot we can do about it. But I agree with that as well. Anyone else from the board any discussion that you guys want to have? Any concerns that you're feeling that you want to have addressed? Okay. Would someone like to make a motion? Go ahead, Wynn.
Coleman, and I have to say that I'm in favor.
Thank you, Wynn.
Okay, so I guess I had it as.
Hear me?
We got you, Wynn.
So the option 1, which I was looking at the.
Okay. Am I able to?
Go ahead,
I
Wynn.
just was going to. Well, I'll go ahead and I will give my input after we have motions. So go ahead, Board Member Cullen.
So was the because I'm trying to go back there, is the option 1 where we require masks for everybody, and then option 2 was the mask pass?
Option 1 is mask.
Right.
Claudia,
Okay, because I think that was different from the other one that I saw
we have Claudia.
the other day. Is that correct? Okay, thank you. So I think I have it reversed on my information here, but it doesn't matter. So this is Board Member Catherine Cullen. I make a motion to approve the mask pass for secondary students. Is that how we want to do it?
I think I'm trying not to talk when your microphone's on.
Sorry. Mine's
Okay, so we have a motion to, there we go. We got it up here. So go up to option 1, Claudia. So we have a motion from Catherine Cullen for option 1, which is the mask pass. Do we have a second?
I guess my question is, so do we not have to vote for the other students? I mean, the ask was the approval of the Rio Rancho Public School recommendations for meeting certain requirements with the PD COVID-19 response toolkit, including mask requirements. I just want to, do we not need to include the elementary kids, or is that just automatic? We don't need to vote on that.
Yeah, so our elementary one is totally automatic. There's nothing that we can do to do that. And so we just have to vote on one of the options that we received from Dr. Cleveland and the district staff.
Okay, all right, good enough. All right.
Madam President.
Yes, please go ahead, Lauren.
Could I suggest also that you address the proposed addendum to the matrix?
Thank you. Okay. Do you want to add that into your motion, Catherine?
Sure, and my motion to include to approve the addendum for the matrix.
This is Board Member Jeff Morgan, I second.
Okay, so we have a motion from Catherine Cullen to approve the option 1 and the addendum, and then we also have a second by Jeffrey Morgan. And Kim, if you could take a roll call vote for that.
Don't we get, isn't this time that we can have a discussion?
Yes, we can. Sorry. Yes, we can go to discussion. Go ahead.
Yes, and so this is Board Member Coleman. And so what I wanted to say is my concern is we had 1 month of being back at the end of the year, starting things out. And while I understand about being more lenient, I have a concern, especially with the variant that has been introduced, and just getting back into the regular routine of dealing with teachers getting familiar, regular teachers familiar with their students, let alone dealing with issues with subs coming in and all of those challenges. So I just have to say, from my perspective, I am in favor of having everybody wear masks. And then, because as much as we can be lenient and then get more restrictive, we can also be restrictive and get more lenient. So I think that it's important that everybody know that we can go either way on that. So I just wanted to be able to have that time to say that.
Board Member
Secretary Scott.
Yes, Board Member Coleman, I agree with you. I think we should have masks for everyone. We have children that are immune compromised, and I fear that we're going to have discrimination no matter how hard we try. And I just think that the uniformity would make it better and easier for the teachers and for the administration in the long term. So I too believe we need to have masks for all.
And Secretary Scott, in support of what you're saying, again, this is Board Member Coleman, that already is happening when it comes to students challenging other students that have not received the vaccination. And so I just would like to see the start of the year go as smoothly as possible, considering everything that happened last year. And I believe that we can at some point then start to be more lenient. I am in favor of everybody wearing masks for now.
Okay. I honestly think and I'm not trying to attack anyone, but I think our student body's better than that. I mean, yes, are there going to be some issues? I think there is. And I think that we could change if we're seeing issues, but we've been living since July where some people are masked and some people aren't masked. And I think that our kids are used to seeing that. And I'm hoping, and I do think that they're better than that to single someone out on whether or not that they've been vaccinated or not. I'm grateful that we don't have to do those cafeteria things or have any sort of segregation. And I think that the district came up with a great thing to have these mask pass. I'm a little concerned that, they'll be losing them all the time because they're students. But, I truly feel like we need to let our students have choice. They need to have a choice. Parents are vaccinating their children. They did it based off of that. They didn't think that they would have to wear a mask. And I wish we could do it for everyone. As a teacher, to teach in a mask, sometimes I just have to like step away from everyone just to breathe for a second. It's hard. It's really, really hard to teach in your masks. But I completely see where you're coming from. And I'll go ahead and let Catherine go ahead and talk.
Just one thing, and even if students are vaccinated, they can certainly come to school with masks. It does not eliminate them having to come with masks. So certainly if they have concerns, if somebody might have an issue at home, or they have an issue that they need to address and want to wear a mask, they certainly can. It's not taking that option away from them. Thank you. And I'd like to call this to question.
Okay. Well, and one last thought too. We have such a great district who came up with a wonderful option for those who are just not comfortable in this sort of scenario. So we can go to vote. Jeffrey Morgan, do you have another? I just want to give him a moment because he didn't get to talk. If he has anything that he'd like to add.
Well, I mean, like you said, I mean, if things get out of hand, if things start to go south, we got the ability to come back and change. I mean, let's put a little trust and faith in the kids and the faculty to see how this thing works. And if it don't, we got the power to come back and make a difference. Yeah.
Okay. Thank you, everyone. We'll go with what Catherine's asking. We'll go ahead and go to Kim. Can you take a roll call vote for us, unless there is anyone else that has to throw in a comment? We're good. Okay.
Yes, I can. I'd like to read the motion back to make sure that I've got it correct. Motion to approve the mask pass, option 1, for secondary students, and to approve the addendum to the discipline matrix as presented. Is that correct? That's okay.
Correct.
Okay. All right. Vice President Morgan.
Yes.
Secretary Scott.
No.
Board Member Cullen.
Yes.
Board Member Coleman.
No.
President Galbraith.
Yes.
Motion carries 3-2.
Okay. Thank you. Okay. Dr. Cleveland, is there anything else you want to address before we move on from this?
Just a comment, the vote looks just like the community.
Yeah.
And so, but a vote has been done, and everyone took all of the information, gave it careful consideration, made a decision. And so we're going to move forward on that. And I echo what all of you have said. If it doesn't turn out well, then we will be back very soon to ask for a change. And then the other alternative is, of course, should the state change, then we will be required to change. And again, just to reemphasize the issue that Vice President Morgan brought up, elementary, there was no flexibility given. And the rationale for that was that those children have not been vaccinated, and therefore masks needed to continue until the time they could be vaccinated and have that additional protection as well. And I do want to thank everybody who has let us know how they feel. This is a tough decision, so we do appreciate you taking your time and sending us how you feel. I wish we could make everybody happy. This is possible.
I do too.
This decision.
I do too. The rest of the board, if there's anything else you'd like to add, I know Noreen is unmuted. I don't know if Noreen, if you had something else you wanted to add. Good.
No.
Okay. Okay. Just wanted to double check. Okay. Well, thank you, everyone. And it's difficult. So thank you, everyone, for giving your time and consideration on that. Okay. Get back into my notes. So for our last business item is the creation of a task force for community input and assistance on capital projects in accordance with Rio Rancho Public Schools Board Policy 207. So thank you, Claudia, for pulling up those slides. So I would like, I just need to pull up my notes since I have things everywhere. But I'd like to create a task force. And as it says, right, for our community input, right now, as you can see on the slides here, we have federal and state funds that exist at the state level. And as a goal, we want to know if and how the community can assist in obtaining funding and leveraging these funds. We would like it to be with the community and with different business partners within our community, because it's important when we go into these things. We have all this money. We want to make sure that when it is available, that we have all of the different minds that we can possibly have to help us to come up with this. And when we have more people in the community working on it, that gives us more backing in the community, and we're more ready for when things come up that we can have. So let me see, what else do I want to hit on this one? Okay, can you go down, Claudia, for me? I want to make sure I'm hitting them. So right now we have some current needs. Our high schools are above capacity, all four, which is based on the state standards. Also, our middle schools are above capacity. We also have our new wonderful, beautiful Shining Stars School, which is a great facility, but we still have a really long waiting list for that. We would love to have another building for our Shining Stars. As a parent who had 3 of my 4 kids who went through Shining Stars, it's such a wonderful program, and so many people would like to be served in our community with that. We also have elementary schools that are in good terms of building capacity, but as we all know, as many of us have walked through schools, that there's need of major repairs, and not just in our elementary schools, and many of our schools all over the district. Will you go ahead and go down for me? There we go. Thank you. She's just good. So we'd like this creation of a task force, and its focus would be these 3 areas here. So career technical education, early childhood, special schools and programs, so such as our Independence High School, which has served our public school community here in Rio Rancho so well, Desert Pathways, and also Rio Rancho Cyber Academy. And so looking at this task force, I would like for it to have 2 board members to be on it. Also, Dr. Cleveland to serve on that board, and then I'd like for us to be able to then discuss how to proceed, and then bring back more to the board, possibly at our next regularly scheduled meeting, if we can kind of pull together exactly how we want to proceed from that. I would like to serve on that board, and I would propose that Noreen Scott serves on that board. It's a task force, but on this task force. Just with her background that she has had in economic development throughout our state, I think that she would be a really important asset to this task force. So with that, Claudia, do I have another one on there? So I think we went through all these. Okay, thank you. So with that, I want to just kind of go to questions. If you guys have questions, I'd like to invite Dr. Cleveland to be on. And actually, maybe before we go into questions, I'd like Dr. Cleveland to just maybe have an opportunity to talk a little bit about the task force, and if she feels that it's an importance for our schools at this time.
Well, what I would share is just a little tiny bit of history. Many years ago, when the district first started, we saw absolutely no way to get a high school. It was at least 10 years out, maybe even longer. And we had a community committee come together and kind of do this same sort of thing. And they were talking about the needs, and everybody in the community was understanding what the needs were. And when that situation presented itself with the expansion of Intel, Commissioner Joe Lang stepped forward and said, maybe this is a way, that we can make that high school a reality. If your community doesn't know the needs, and you're not talking about it, and people aren't advocating for it, then when an opportunity comes, you may miss it altogether. And so looking back at that task force, it certainly helped us get what was then an impossible dream and get that accomplished. So I think it would be a great idea. The other thing that makes it unique with Rio Rancho High School, it was the IRB, the $8 billion investment. But what we have right now is something completely different, and that is all of the federal funds that the state is sitting on. And one of the concerns that I have, and I think other districts have, is if we're not ready to move when the opportunity presents itself, that money could go back to Washington. And what a shame that would be in a state that has so many needs, as Mexico does. Well, we want to be there. There's no guarantee. There was no guarantee last time, but I do think it's a great idea. And I think it would get the community talking about our needs, and I had a group that I presented to a few weeks ago, and they were shocked when I told them, given our current tax projections, it would probably be 20 years before we could build another high school, unless we find a unique way to do it, as we did for Rio Rancho High and how we did for our second high school. So that's just a little bit of history, but I think that the community can leverage it. And then my last comment is, you go and ask for things in Santa Fe, the more partners you have at the table, the greater the likelihood that you're going to get listened to. And I think if you have a lot of people in your community, especially those that may have some contacts that we don't have, could be a positive thing for us. And I've shared that with Chris Balzano, and he says it's a good thing to have your whole community talking about what your school district needs are. Sometimes what I feel is that today we've done a good job overall. We're certainly not perfect, and we've got a long way to grow. But sometimes people don't know the needs we have today. They don't realize how serious the needs are that our district is facing right now. So that's just a little bit of history. I can't help but be a history person. But I think that history has real lessons for us to be learned from today.
Thank you, Dr. Cleveland, for adding all of that. And I look at our CTE program, and I just, there is such a need right now in our community, in Rio Rancho specifically. I have a brother-in-law who works in construction, and he was talking about the needs that they have for construction workers, and we just don't have those, and I look at some CTE as something that's really important if we can get a community really involved in that. One thing that I neglected to do is to ask Noreen Scott if she was interested in serving on this. I haven't actually talked to her. So let me give you a second to talk, Noreen, and then we'll go ahead and go over to Wynn, who has her hand raised. Go ahead, Noreen.
I'd be honored to serve. I've worked in the business community in this community for over 20 years, and I know them to be generous and thoughtful and always in support of the school district. And I think it's a very wise move to draw upon that talent now and get that feedback from folks. And anything I can do to support that, I'm thrilled to do.
Thank you, Secretary Scott. And let me go over to Wynn Coleman, who has her hand raised.
What is the time frame for this?
So I think it's going to, I may actually ask Dr. Cleveland, because I haven't been on the board long enough. When we're looking, Dr. Cleveland, at a task force like this, and your thoughts on it, and how much time do you think it'll take to kind of pull everyone together and to go through the needs that we need to hit?
Well, I think a lot of that will be determined by the task force itself. We'll kind of look at it. But if you want to influence the next legislative session, you've got to have information before the session in January. And so everything kind of focuses around legislation or some funding. The other is the CARES money. This is something everybody really needs to think about, is that in 3 years, it's going to be gone. And if you haven't spent it and invoiced it and gotten it off, then you lose that opportunity. So yesterday is really when, we've got to get moving quickly in order to have any kind of influence on the process. The other thing, and spoke today with Mike Baker, and I had spoken with Melanie about that, is also, this is good information as our facility master plan committee continues to work as well, to give, additional community insight into that. So I would think it needs to begin very quickly, and certainly under the board policy, these have to have a beginning and an end and a time framework based on what Wynn is saying. So I would think that it would certainly be early 2022 when you would have to have some recommendations that would come back from that group. And then, the board can either decide to extend that or not. Some communities have a permanent committee that works on that. Catherine Cullen has shared that at some point. But I think it would be very wise to start with what the board policy allows, and then the board could reconsider that if at some point you wanted it. And Lauren would have to answer whether you can add a standing committee. I don't know if you can even do that in New Mexico. because you have two that are standing by statute only. And so I think the having a start date and an end date is really important. So as you said, President Galbraith, we'll bring back more specific information with the whole board. Perhaps after a committee is formed and kind of get an idea of the time frame. I do think we can have a continuing relationship though with some of these, and we have had for years. We've had continuing relationship with some of these entities for many years. But this is a task force, and that's something a little different.
Thank you, Dr. Cleveland. Let me let Catherine go ahead and address. I think Catherine I saw you nodding your head and such, so go ahead, Catherine. And
Yeah, I don't think there's anything that doesn't allow you to have a standing committee permanently. A lot of school districts have that, particularly with capital outlay. I think Santa Fe has it, APS, they have a number of committees that are continuous. So, but we do have two that we have to have per state statute. Any of the other ones can be formed by the board. But this particular one is, we would want to probably have the begin and the end date. And then I wanted to ask, how many members were you looking at? Are you looking at some parents on there, as well as some of the businesses and also some administrators from the schools? Because you're touching on CRT. I mean, not CRT. See, you got me doing that today.
I know. Yes. No, I told you we're not going to go.
Yeah.
Be careful.
Yeah, career technical. And then with Desert Pathways and Independence, I want to make sure that they're represented on this committee, on this task force. So with that, I wanted to see what your thought process was on how many are going to be on this committee and how we're going to be representing these different schools.
Okay. I'm going to let Lauren talk in just a second. But just to, you want to mute yourself, Catherine? There we go. I can hear myself. But just as we're looking right now, like I said, we have the two board members, superintendent. We'd also have the business and community members, which definitely probably should include some of our parents and different district staff. But we are going to probably need just some time to just sit down and discuss how big it should be. Dr. Cleveland, do you have a thought on what we're looking at, you think, for how many?
I haven't given any thought to that. We haven't, you and I didn't discuss that, so I don't know. But I do think that the challenge of this task force may not be the same as the facility master plan committee. But I do notice that, and I believe Board Member Cullen, you raised the issue some time ago about the facilities master plan not having building level administrators and parents on it, and we took note of that. I think we maybe need to be able to discuss that, but I think this committee may be a little bit different. The goal is to, in the short term, go after and get money, as opposed to decide priorities. And I think those are two very different things. So I do think that in terms of setting the priorities, that larger committee may be very important to have. I absolutely support that. I think that's it. In terms of actually in the short term, looking to see how we can leverage funds and perhaps get money, it's a different committee and it's a shorter term committee. And their goal is to go get funds. And I forgive me for this kind of personal thing, but I serve on the foundation board for Pres. And it's really clear. Our challenge for that board is to go get money for Presbyterian and to raise revenue for the highest needs of the hospital and the healthcare system. So I think we could come back. I think you've raised some really good issues. Maybe they're not the same group. And maybe the facilities master plan group, maybe the larger group, I don't know. But I'd love to have an opportunity to just kind of think about that. This is kind of new. And then we would come back and have that discussion. But my first thought is this first task force isn't as large because we've got a short-term task and we've got a limited time to see if we can leverage and get that money before it disappears. So but I'm just thinking out loud. And truly, I have not really thought it through. Just thinking out loud. My initial thought is they're not the same.
And it does need to be clearly defined, as you're saying, Dr. Cleveland, and this is something that I think has to do with the funds that are out there, and that it does need to act quickly. It's not something that's a long-term type of committee for, I think what I'm figuring is what you want with this task force is something that for the immediate needs that we kind of need.
Yeah, okay, before I go to the raised hands, I'm going to let Lauren go ahead and talk about the legal things that we just talked about, and then I'll go back, and then I'll go over to Wynn and Noreen. Go ahead, Lauren.
Thanks, Madam President. I'm Lauren Hatch, General Counsel for the district. I just want to confirm kind of what has already been said, and the board can definitely set up a committee like this. The way our policy reads, it kind of implies that it's going to be less than a quorum of the board. However, it does contemplate that there's a possibility that there could be one that's more than 2 people or 3 or more people, and that's possible as well. If it's going to be something that's a standing committee for a long period of time, it might be helpful to actually define it in policy itself. So that's another option as well. Policy 207 does say that an ad hoc committee needs to have a statement of purpose, and there needs to be some timelines associated with it. An ad hoc committee, it implies lasts no longer than a year. But I think it could just be re-upped if you wanted to approach it that way, or there could just be a new section added that establishes the guidelines of this committee. I hope that's helpful.
That was helpful to me. Thank you. Is that helpful, Catherine, with what you were saying? Okay. All right. Yeah. Thank you, Lauren. I appreciate it. Wynn Coleman, and then we'll go to Noreen after.
Yes, thank you. So I was going to, and thank you, Lauren. I was going to point out that we have that policy in place, 207. And what I also wanted to let you know is that that's something that the Behavioral Health Advisory Committee created just based on statute. I'm more than happy to make sure that you have a copy of that as you put this together, so you kind of know kind of what we did, because it's not that often that the district creates these kind of ad hoc task force or committees. But I do want to say that at some point, when it's appropriate, I think it's really, really important that we have students involved in this, and that since they are there every single day, that we're also hearing from that demographic of our community.
Yeah, thank you, Wynn, for putting that on there. And I think that we could bring students in. I don't know I don't know. We should talk more about it, whether they sit on the committee or they come in and just discuss, their schools as we kind of go through it. So, but thank you. And I would love to see your notes that you have on that. Noreen, Scott?
And that's all part of the process.
Just
saying that, and excuse me for interrupting.
No, you're good.
That's all part of the process, and that's where that statement comes in, and writing that about what the task force or the ad hoc committee really, the purpose, the intention, and things like that, including things. So I'll share that, but I do, regardless of how you all decide, I think it's really important, since we always talk about how, students are our priority, that they are, make sure that they're heard.
Yeah, thank you. I agree. All right, go ahead, Noreen.
I see the purpose of this committee, just listening to what everybody is saying, as looking for creative ideas for funding our facility needs. I mean, we've got a variety of needs, as many of us went around and looked at the facilities over the last couple of weeks. I think we had our eyes opened to some of the really clear needs. And Board Member Cullen has pointed out about independence and CTE. I think she has been a passionate driver for CTE. And so I guess if I sit here and hear what's being said, maybe what we ought to be doing is looking at a task force that starts today and runs through May of 2022. That would be 9 months. So May 2nd, 2022. with the goal of finding some creative ideas for funding our facility needs. And during that time, I think we would also be looking to create or to have created a long-term facilities committee that could be looking at all of our facilities and perhaps be headed by Melanie, who certainly is very knowledgeable about that. I was thinking, since we're going to be looking for creative ideas, that perhaps our district school attorney ought to be on the committee, so that we're sure that every creative idea we have is legal and is doable. And I guess I would be asking other staff people who had an interest and the time to participate. I think that those are kind of just my thoughts from listening to everybody, and I'd be open to hearing more.
Yeah, thank you, Noreen. I think that's, I actually really like that timeline. I don't know if that works for everyone with what we're thinking. Dr. Cleveland, what do you think of that timeline?
I think that's fine. I think that will work very well. I do think that by the end of next year, this school year, there will be only 2 years left if we are able to access any federal money. Again, it's an if. If we are able to access it, there'll be 2 years left to use it. And that doesn't mean encumber it. It means encumber it, spend it, and get it invoiced, the best I understand. So, pushing as hard as we can, but I think it would be very wise to leave it open till the end of May. And as I said, if there's anything that tried to do to influence legislation, that has to be done before the session in January. So I think there's some other timelines that might be built in that. But the dates are good, and do what we can in the order that we can. I just can't stress the urgency of this is once in a lifetime opportunity, the money that the state has right now. We will probably never again see this. And so, we can't promise the public or the community, anyone, that will get any of that. But what I would want to promise them is we did everything within our power to see if we were able to secure some of that funding for the students via Rancho. And so I do think that that's the motivator. We have such needs. You all are aware of all the needs we have. And I think it's just important we give it our very best shot. And I do believe that everything I've seen in Santa Fe over many years, that I think our lobbyists will shares that sentiment. As you get further with partnerships, you get further when you have more people at the table that are supporting. And that's the goal, is get more people behind us that either have some way to influence the process or to be able to speak to the governor or able to have our voice heard. And I think that's what we're trying to speak with a louder voice about the needs that we have in this community. So those are just, we have a normal pace by which we can get things done. None of that applies right now. Right now it's move fast or lose it. And I think that's what we're trying to do is there a way to move quickly to at least have a shot at it. Again, there's no guarantees, and I want everyone to know that. There are no guarantees. But then we pulled off the impossible a couple of other times historically, the things that we thought people could not do. And so I'm hoping maybe we could have a third one, which would help us get some of those needs that we have fulfilled.
Thank you, Dr. Cleveland. I think that was really well said. Noreen Scott, you raised your hand and then it went away. I don't know if you were just hitting buttons. Okay.
Just bumped a button.
That's fine. But Catherine Cullen has her hand raised. Go ahead, Catherine.
So, Dr. Cleveland, my understanding is with that money, there's some that, does that task force need to come back with recommendations sooner rather than later?
Truly, I think everything is sooner than later. Board Member Cullen, I mean, we've got to get moving quickly on everything.
That's what I'm thinking. I mean, I think that, you can't delay. Some of these things need to be moved really quickly. And that will have to be established with the task force of some, not just like you said, at the end of May of next year, that's how long it could run. The task force probably needs to make some recommendations pretty quickly, rather sooner than later.
I agree.
Okay, thank you. So I go ahead and make a motion to go ahead, allow the board to create, and I don't have I put my papers at a task force for, thank you. Task force community input and assistance on capital projects in accordance with the rearranged board policy 207.
Okay, we have a motion. Do we have a second?
This is Board Member Jeff Morgan. I second.
Okay, we have a motion by Catherine Cullen and a second by Jeffrey Morgan. And Kim,
you know what?
Go ahead.
Lauren, I would think that since we probably also have to make a motion to approve the 2 board members that want to be on that. Would that be correct, Lauren?
Yeah.
It wasn't stated in the agenda for appointees on it, but I think I can do that here, shouldn't I?
Madam President, I'm not clear at this point. Is the intention right now to create the committee and also give it guidance, or were you going to come back at a future time and do that part of it?
Sorry, I can hear Catherine. There you go. So for now, and maybe Dr. Cleveland can help me out with this, I think we can go ahead and create it. I do think I'd like to appoint the 2 members, but we'd come out with the different parameters of the committee. We'd have to go through that, like for who's going to sit on it throughout the community and stuff. I don't have that information right now, so that would be something we'd have to sit down. Go ahead.
Okay. What the policy says, if you're looking at 207 and 206 together, putting people on a committee can happen one of 2 ways. The default rule, as I read it, is that the board president appoints members of a committee unless the board directs otherwise. So I guess it depends on what the board's pleasure is at this point. You could appoint the 2 members, or just if that's what the president's going to do and you're comfortable with that, she could just make the appointment as well.
Okay, that's good. Then I can just leave my motion as it is, and then that way that the president can go ahead and appoint. So we don't need to go to add another vote on that. So my motion stands.
Okay, thank you. And we'll go ahead and go to, if Kim can take a roll call vote for us on it. Oh, I got a second, right, from Jeffrey Morgan, or did I make that?
Yeah, you do have a second.
Okay. Mike, did I imagine that?
You do have a second, but as with the last one, I want to make sure I got the motion straight. Motion that the board create a task force for community input and assistance on capital projects. That's the motion, right? There's not more to it than that?
It would be in accordance with the policy, correct?
Oh, in accordance to oh, yes, thank you.
Okay.
Yes.
In accordance with policy 207. Okay. All right. Vice President Morgan.
Yes.
Secretary Scott.
Yes.
Board Member Cullen.
Yes.
Board Member Coleman.
Yes.
President Galbraith.
Yes.
And the motion carries 5-0.
Thank you. Dr. Cleveland, do you want to add anything to it before we move into advanced planning?
I'm a little confused as to what we still need to bring back because of the action that was taken.
Okay.
We can get together and kind of figure out what we do, but thank you. I think this, to your point and to the point of several of the board members, we need to get moving on this quickly if we're going to have any impact at all. So thank you for taking this idea, and sounds like a good opportunity for us. Also want to really stress that we also have a facilities master plan committee, and that committee does not cease to exist. It's still a very important committee. Will still continue to do its work as well, but some of their work might be informed by, it should be informed by some of the things we may learn through this process. So, but where I'm a little confused, I'll get with you and we'll figure it out.
Okay. Sounds good. I think probably at this point, more than anything, we can just report back kind of just so you all have an idea of what's going on with the committee and as we move through it. So thank you, Dr. Cleveland, and thank you, board. Anything else on that? Okay. Okay, thank you. I appreciate everyone being willing to create that task force. So moving into our advanced planning. So August 5th, we have the first day of classes for middle and high schools, and it gives me anxiety just to say that. August 9th is our first day of classes for elementary school. Also on August 9th, we will have our regular scheduled board meeting at 5:30. It will be in the boardroom and also virtual. August 19th, we'll have an audit committee open meeting and an executive session at 4:30. That will be virtual. And then August 23rd, we'll have a regular board meeting at 5:30 in the boardroom and virtual. So with that, our meeting is adjourned for tonight. Thank you all so much for being with us.
Thank you.
Thank you. Thanks, John, and thanks.